Welcome to Public Health Unfiltered by Endas, the podcast where we have real conversations, real issues, no filters. I am Michaela Drake, your host, and our mission is simple: breaking stigma through real talk. Here, we talk about public health, education, and the real issues affecting our communities and our world. Bringing in experts, sharing stories, and creating safe space for dialogue. Whether it's mental health, social stigma, or community wellness, this podcast is about understanding, empowering, and taking action because public health isn't just about policies, it's about people. So tune in, join the conversation, and let's get real. Welcome to episode 1, and we're talking about the basics. What is public health? Public health is about improving the health of communities and not just individuals. It focuses on prevention, education, and making sure people have access to the resources that they need. So instead of just treating the illness, public health works to prevent it in the first place. This looks like health education, mental health awareness, and addressing stigma, or even making sure communities have access to the care and accurate information. This reason matters because a lot of people do not realize how public health affects their daily lives. And that is why conversations like these are important, because when people understand public health, they can take action. And when we're thinking about public health, this goes to the community level. We have population health, we have global health, and all of these things are connected when we're talking about public health. And we address issues and research different things that we are having in the world. So when we're talking about public health and public health issues, we have several career paths and roles, and these are a few. We have epidemiologists. These are people who look at the patterns, causes, and the effects of diseases in populations. They also help track outbreaks, identify risk, and inform policies to prevent illness. Community health workers, people like me. We educate, support, and connect communities to resources, helping bridge the gap between healthcare and the people who need it most. Health data analysts and informatics. They manage and interpret health data, using it to make decisions about programs, interventions, and policies. Environmental health specialist focuses on making communities safe, from clean water to proper sanitation. Health educators and policy advocates. They create campaigns, teach people about healthy behaviors, and push for policies that improves public health. And these are just a few examples of how public health touches almost every aspect of life, from schools such as your cafeteria worker, your janitor, to the workplace such as your admin specialist, the people who make sure that your environment is clean, safe, and meeting the regulations of your employer or in your environment. From hospitals to community centers to your health department, and even at a global level, such as the CDC, we have NIH, we have different global levels that we touch as public health. And one common thing that us public health experts have in common is research. Research is very vital to public health and making sure that we put out the proper information and getting down to the root of the illness or the issue of what we're trying to prevent and educate and talk about. These things are very important to everybody's daily lives, and making sure that we have healthier lives, longer lives, a safe environment, safe community, and a safe world where we look from either the food that we eat, the air that we breathe, the water that we drink, how we throw away things, are we throwing away things properly? Are there things that we're doing incorrectly that we can do better? Are there policies that we can implement into the world that makes it a better place? We all work together hand in hand, working with doctors, dentists, lawyers, world leaders, and making sure everything is possible. Thanks for tuning in to Public Health Unfiltered by Endas. I hope today's conversation gave you insight, challenged your perspective, or inspired action. Remember, our mission is breaking stigma through real talk. And that starts with each of us having honest conversation, staying informed, and supporting our communities. If you enjoyed today's episode, make sure to subscribe, leave a review, and share it with someone who should hear this message. And do not forget to join the conversation on social media. Let us know what topics you want us to cover next. And let's keep taking.